All right. All right. So welcome. It's April 15th. Oh, it's tax day, theoretically, even though they've postponed all the taxes and all the things. But I don't even remember what week this is, probably week 5. And we've got Clara here. So Clara, we've been doing tapping on COVID related emotions, anything at all related to COVID. So it could be, fear, anxiety, boredom, irritability with people that you're sharing your home with, anything like that. So what would you like to tap on today?
Well, I think just this underlying anxiety I have about the fact that there's so much disparity, and I knew it, I was aware of it, but now experiencing the disparity in the lower socioeconomic cultures, the economic folks, the minorities, lately the Native American Indians, I've been reading about their lack of, they don't even have people that know how to use a ventilator in their hospitals. So it's just, sad. And I try not to dwell on it, but it can be overwhelming.
Okay. Does it feel like more anxiety to you or more like sadness?
Sad.
Okay.
Sad and helplessness.
All right. And how strong is that sadness on a scale of 0 to 10, 10 being the strongest?
I would say a 5.
Okay. Have you ever done tapping before?
No.
Okay. So basically what we're going to do is it's like call and response. So I'm going to take you, I'll be tapping on different parts of the face and chest, which are the tapping meridians that are the same as those used in acupuncture and traditional Chinese medicine. And you did good by taking your glasses off. If you haven't washed your hands recently, or if you've been outside at all, you might want to wash your hands before, because we'll be touching our face. And I'm going to be saying things out loud that I'm like your proxy. So I'll be saying, I fill in the, whatever, but I'm saying it as Clara. And you'll repeat after me. So I'll be tapping on a specific meridian, and I'll say something, and then I'll pause, and you'll be tapping along with me, and you'll pause. And for anyone watching this at home, you can get the benefits by tapping on the same thing that Clara is tapping on. If you're having sadness and helplessness about the healthcare disparities right now, are that are made much worse right now, or much more clear right now, or you can even keep your own emotion in the back of your mind, or actually in the front of your mind, or write it down, and you can still tap on the same things that Clara and I are saying. You can still repeat them and tap with us and get benefits, even if you're tapping on a completely different emotion. So anyone watching from home, make sure you've got a pen and paper, write down whatever emotion you want to be working on, and also write down how strongly you're feeling that emotion right now, and we'll stop and check in. So the tapping points, I'll just show you what they are real quick, and then we'll get started, because I don't want to spend the whole time talking about tapping. I'd rather just get started tapping. So there's the karate chop point, which is right here. So if you want to show me that, and you can tap on either side. When we get to the face, you could potentially do both sides. I usually tap with my right hand on the right side of my face, but it doesn't matter at all. You can do whatever you want. And then we have top of the head. We have the inner corner of the eyebrow. So like right here where the eyebrow meets the nose, or the top of the nose, I guess. Side of the eye. Under the eye. Under the nose. Chin. And then we do the collarbone. So if you go to this little notch right here in your chest bone, you go down an inch and over an inch. So it can be either side. You can tap on it. I like to use my fist and kind of bang on my chest like Tarzan. And then the final point is under the arm where a bra strap would go. You can reach over and tap. You can tap under. I like to use the side angle part of my fist, because it's just easier for me. And then we'll start back up at the top of the head. Okay, so that's the sequence that we do. Do you have any questions before we get started?
No.
All right, let's do it. So I'm going to start with a statement called a setup statement. And also, as a reminder to anybody at home and to you, this is not a substitution for medical care, for mental health care. This is a sort of exercise and trying to improve our mood and how we're feeling. But this, if there's anything more serious going on, definitely call your mental health professional or your physician. And doing this video with me does not imply any sort of ongoing doctor-patient or tapping practitioner-client relationships. I just always like to put that out there. Okay, so we're going to tap here and we'll say, even though I'm feeling sad and helpless about all the healthcare disparities.
Even though I'm feeling sad and helpless about all the healthcare disparities.
I love and accept myself.
I love and accept myself.
Even though I'm feeling so sad and helpless about all of the unequal access to healthcare.
Even though I'm feeling so sad and helpless about all the unequal access to healthcare.
And the worse outcomes in lower socioeconomic status areas.
And worse outcomes in the lower socioeconomic status.
I accept and forgive myself exactly as I am in this moment.
I accept and forgive myself exactly who I am in this moment.
Even though I feel sad and helpless about the lack of resources for some of the communities in our country.
Even though I feel sad and helpless about some of the resources for some of those folks throughout our country.
And how much inequality there is.
And how much inequality there is.
I love and accept myself completely.
I love and accept myself completely.
Okay, so now we'll go to the top of the head. I'm sad.
I'm sad.
And the next point, all this sadness.
All the sadness.
I feel sad and helpless.
I feel sad and helpless.
I'm sad about all the disparity in healthcare in our country.
I'm sad about all the disparity in healthcare.
The Native communities and other marginalized people are having much worse outcomes.
The Native Americans and the other marginalized communities are having, I didn't hear that.
Much worse outcomes.
Much worse outcomes.
And they often don't have, and go to the next point, they often don't have access to the testing and medical expertise.
They often don't have access to the testing and medical expertise.
So they're already marginalized in our country.
They're already marginalized in our country.
And this is making it so much worse.
And this is making it so much worse.
And I feel so sad.
And I feel so sad.
All this sadness.
All of a sudden.
All of this sadness.
All of this sadness.
I feel sad about the healthcare disparities in our country.
I feel sad about the healthcare disparities in our country.
And coronavirus is making it so much more evident.
And coronavirus is making it so much more evident.
Everybody is struggling right now.
Everybody is struggling right now.
But a lot of people don't have the privilege to stay home and stay safe.
But a lot of people don't have the privilege to stay home and stay safe.
And that makes me so sad.
That makes me so sad.
All this sadness.
All the sadness.
I'm sad that coronavirus is affecting certain people much more strongly.
I am sad that coronavirus is affecting some people more strongly.
Certain people are unable to get out of harm's way.
Certain people are unable to get out of harm's way.
And those people have already been treated so poorly in our country.
And those people have already been treated so poorly in our country.
It breaks my heart.
It breaks my heart.
So sad and helpless.
So sad and helpless.
I wish there was something I could do for these people.
I wish there was something I could do for these people.
But I'm stuck at home just like the rest of us.
But I'm stuck at home just like the rest of us.
And that makes me so sad.
And that makes me so sad.
Okay, so let's pause, take a deep breath. So Claire, what came up for you while we were tapping?
I felt that you shared my thoughts, all the thoughts that I have throughout the day that I just kind of get there, and then I try to brush them away because I can't do anything about it. But I felt this immense heart, especially when you said, I'm stuck at home like everybody else. Because I am, and I realize that now, and the fact that that emotion, I have some compassion for myself now, a little bit more, because it's not as overwhelming. It's there's a little bit more self-forgiveness that I have to realize I can't get out. So that's part of it. That's part of it.
Okay.
And acceptance, I guess, accepting that this is out there and it's real. And right now I can't fix it.
How strong is the sadness and helplessness?
There's a yeah, it's pretty much in my heart center right now. It's like very physical. And but it's not choking me. It's
Okay.
been choking me before.
Okay. Are you able to give it a number? Before it was a 5 out of 10, you said.
I don't, you know what? It's more of a love right now. I
Okay.
just feel it's outpouring of love right in my heart center for all these people.
Oh, that's beautiful. I love that. So the sadness is gone and it's more of a compassion and a love.
Yeah.
Okay.
Yeah.
That's wonderful. That's wonderful. Yeah, it is such a hard, powerless feeling of like, what am I supposed to do? And we've all been sort of trapped in our own internal stresses right now, even more than normal. And I think more and more is coming to the forefront of what's been going on in other communities. And as time goes on, we've all had time to kind of start to adjust to this new normal and start to regain our sense of, oh yeah, there's a world outside and all this stuff is going on. Not that we weren't thinking about it at all, but it's a lot, there was a lot less, I feel like, with myself and a lot of other people, a lot less bandwidth to even contemplate life outside, which felt.
Yes. For the first 2 weeks, I have to say that I was in a little bit of a shock and thinking that, okay, this is just going to be hunkering down for this short period of time, not realizing all the people who couldn't hunker down.
Right.
And now, yep.
There's a lot of different levels of it. I've started doing an interview series of different people who are working with people in these marginalized communities, physicians, and also I'm looking to speak with other people as well, maybe lawyers or accountants or people who are working with people to, to see how things are going, even like if they're able to get some of these loans and access to some of these resources that the government is giving out. So I've been trying to get myself more educated and help other people get educated about what's really going on. So, all right, well, let's tap in some positive. It sounds like you're pretty much down to a 0 in terms of the sadness. There's a lot of disparity in our healthcare system.
There's a lot of disparity in our healthcare system.
And in our country in general.
And in our country in general.
And the more I become aware of what it's like for other people during this epidemic.
The more I become aware of what it's like for other people during this epidemic.
This pandemic, I guess I said it wrong. The more love and compassion I have for people who are in a worse situation than I am.
The more love and compassion I have for people who are in a worse situation than I am.
I feel this sadness and hopelessness and leaving my body.
I feel this sadness and hopelessness leaving my body.
And in its place is a lot of love and compassion.
And in its place is a lot of love and compassion.
And I have some of that love and compassion for myself as well.
And I have some of that love and compassion for myself as well.
Recognizing that I'm stuck at home.
Recognizing that I'm stuck at home.
And there's not a whole lot I can do right now.
And there's not a whole lot I can do right now.
But I can hold a space for these people in my heart.
But I can hold a space for these people in my heart.
And maybe I can find some ways that I can help from home.
And maybe I can find some ways that I can help from home.
And I know that when this pandemic is over,
and I know that when this pandemic is over,
I can be grateful for my own safety.
I can be grateful for my own safety
during this time.
And
I can remember how much love and compassion I felt for other people during this time.
And I can remember how much love and compassion I felt for other people during this time.
And I can keep that love and compassion.
And I can keep that love and compassion.
And that can motivate me to help more once I'm allowed to leave my house.
And that can motivate me to help more once I'm allowed to leave my house.
I feel the sadness and helplessness leaving my body.
I feel the sadness and helplessness leaving my body.
And I feel so much love and compassion filling my heart right now.
And I feel so much love and compassion filling my heart right now.
There's lots of things to be sad about right now.
There's lots of things to be sad about right now.
But there's also a lot of ways to feel connected to everybody.
But there also are a lot of ways to feel connected to everybody.
And I'm going to hold on to that sense of connection and love.
And I'm going to hold on to that sense of connection and love.
And whenever I do feel sad and helpless,
and whenever I do feel sad and helpless,
I'm going to sit with that feeling.
I'm going to sit with that feeling.
Because if I shove it away, it's not going to go away.
Because if I shove it away, it's not going to go away.
And it's going to feel like it's choking me again.
And it's going to feel like it's choking me again.
So now I know that there's ways to process my emotions.
Now I know there's ways to process my emotions.
And I can tap on any emotion that comes up.
And I can tap on any emotion that comes up.
And it can help shift me from a negative place of fear.
And that can help shift me from a negative place of fear
and anxiety
into
a more positive place of love and compassion.
Into a more positive place of love and compassion.
Even though nothing on the outside is really changing.
Even though nothing on the outside is really changing.
I have the power to change my energy and my emotions.
I have the power to change my energy and my emotions.
All right, let's pause. Deep breath. So what came up for you while we were tapping?
More of a kind of an intellectual processing of that big heart emotion I was feeling. Mm-hmm. And now just a calmness and a more empowerment, because this chaos and calamity can't last forever. It's got to reconcile itself, and then I can be part of that positive transformation process. So that's what was going on in my head, and ways, I was already thinking about ways to help.
Great. Well, what did you come up with in terms of ways to help?
Well, one thing I'm going to do is just reach out to some people to hear their stories. Some people came to mind who are involved with the indigenous population from a legal perspective, and they're family members of mine, and I haven't talked to them, so I really need to talk to them anyway. And so that's the first thing, just listening, and then deciding to look at where needs are after that.
That's amazing. I love that. I did an interview with a doctor yesterday who works in Pittsburgh. She's a pediatrician, and she said that there's a lot of organizations, all the ones that are doing all the things that they are always do, they're still doing that work. So they're still bringing food and bringing formula and bringing, you know, sanitary supplies and all sorts of stuff. And so she said the United Way is a really good organization
Okay.
for money donation, or if you have supplies, like if you have extra toilet paper or extra sanitary supplies or diapers or whatever. I don't know if you have any access to diapers, but anything like that that's going to be needed. There are still organizations on the ground that are still doing the work that they do. So
Great.
there are ways that we can funnel our good intentions outward. And I think reaching out and listening and finding out where the needs are, that's incredible. And I think there's more that we can do than we realize. It's just very easy to shut down because it's almost too overwhelming to think about. So I think you did great, Clara. Thank you so much for joining.
Oh yeah, thank you so much. It was good to see you again.
Yeah, you too. You too. It's been a long time. And if any of your family members are on the legal side of the Native population, if they want to be interviewed and talk about what they've been doing for that population, I'd love to interview them.
Okay. Okay.
If you talk to them and they're open to it, please connect us.
Yeah. Yeah. Great.
All right, great. Thank you, Claire. Thanks for coming.
Bye-bye.
Bye-bye.
And thank you.